What was really interesting was that we had a lot of common friends, and all our common friends came to me and said, "Look, you're a cardiologist. This has been a shocking incident. Can you test me out now to try and stop this from happening to me?" I very foolishly said, "Yes, I'm a cardiologist. I'll check you out and I'll make sure you're okay." And so I embarked on doing a series of investigations on these people, um, and found that they had a little bit of something, but nothing particularly horrible. But I couldn't console them that they were risk-free, because the more I looked, the more I realized that actually we can do very little to stop bad things from happening to you. You know, we may be able to do it to a population. So
Right.
you can say, okay, you take a population of 1 million people, you give them all a statin or something like that. Maybe some will outlive others, but not everyone outlives everyone else. And so, who is that individual? Is you the person in front of me? Are you going to be the one that benefits, or are you not? And will you even ever know?
Right. So, outside of the current situation that's going on globally, what is a day in the life of Dr. Gupta like? Like, what kind of patients do you see nowadays, or who comes to see you, and how does your day-to-day life go? Maybe on a patient to patient. And then the next thing I'd like to say is, you're a bit of a YouTube sensation out there, and people are gathering information from a lot of levels. And we'll talk about that in a minute. But then, what's the bigger vision that seems that you've kind of connected your career to? I'm curious about that.
Yeah, thank you. Well, a lot of my daily work is just, I would go from home after a breakfast, and then I would go in and go to our coronary care unit where all the sickest patients are. You introduce yourself to them, you talk to them about what's been going on, you plan their management. After that, I would go and see patients on the wards, and then in the afternoon, we would often do a clinic where people who are not so unwell, but who've waited several months to come and see us, will come with their chronic problems, and we try and address those. And to all intents and purposes, that is, there's nothing too exciting about it. Once you've done it once or for a year or 2 years, it gets a bit boring. The way I started with the YouTube channel was a very interesting experience. A few years ago, again, I was just doing my normal thing, being a doctor. Person comes, you give them the tablets, you give them the usual spiel, you send them out. One thing I had noticed was, well, it was getting a bit monotonous. Two, I didn't think anyone was really getting any better. Yes, they would go out of the door, but I'd see them 6 months later. I'd see them a year later, and they'd be worse, and then they'd be worse. So you were seeing the same people over and over again, despite all these kind of advances in medicine, despite all these pills. Why are all these people coming back? So that wasn't fun, because you're having to deal with the same patients, so you've never really done anything corrective for them. And then things changed, where we had a very interesting and sad experience where one of my friends suddenly, out of the blue, had a heart attack. And it was a shock, but, not a huge shock for a cardiologist. There was nothing special about that. What was really interesting was that we had a lot of common friends, and all our common friends came to me and said, "Look, you're a cardiologist. This has been a shocking incident. Can you test me out now to try and stop this from happening to me? I need to get checked out." And I very foolishly said, "Yes, I'm a cardiologist. I'll check you out and I'll make sure you're okay." And so I embarked on doing a series of investigations on these people, and found that they had a little bit of something, but nothing particularly horrible. But I couldn't console them that they were risk-free, because the more I looked, the more I realized that actually we can do very little to stop bad things from happening to you. We may be able to do it to a population. So
Right.
you can say, okay, you take a population of 1 million people, you give them all a statin or something like that. Maybe some will outlive others, but not everyone outlives everyone else. And so, who is that individual? Is you the person in front of me? Are you going to be the one that benefits, or are you not? And will you even ever know?
Right.
So that's a really interesting thing. And then, so when I was then faced with having to explain this to my colleagues, they were saying, okay, what can we do? And I'd say, oh, this is good. And they'd say, how good? I wasn't used to this. I wasn't used to anyone asking me how good. Everyone, I would say it's good. People would take the tablet. Here, I'm dealing with a bunch of people who see me as their friend, and they're now asking me how good. So I was saying, well, I'll have to go and look because if something is good, there must be a number to tell you how good, right? It's a very valid question. It has to be quantified in some way. So I'd go and look at the research and say, well, why is there no clarity over numbers? How good is something? So anyway, after great research, I found that actually, yes, it's good, but it's not that good at all. You would have to treat. So something like aspirin, for example, I was stunned. I thought, okay, well, how good is aspirin in someone who's never had a heart attack at preventing a heart attack in the future? You go to a doctor, they'll say, yeah, take aspirin. Aspirin's good. How good? And the answer was you'd have to treat 1,667 people for a year to prevent one something minor in one patient.
Wow.
The equivalent of putting $1,667 in the bank for $1 in return at the end of the year. And that dollar isn't even yours because we don't know who that one person is who would benefit. You would have to treat the 1,667 people for someone to benefit, but no one will know who it is. So it's like, it doesn't make sense. It doesn't make sense. And certainly to my mind, I thought, gosh, is this the benefit? Is that all there is? Are these the benefits that we're talking about? Everyone's been given aspirin, everyone's been given this. So the more I look, the more I realize that actually medicines make very little difference. Yes, they may make a difference to a population, but they make very little difference to an individual. However, and in some ways, when you are trying to treat people for length of life purposes, you will never know. However, more important than length of life is quality of life.
Mm-hmm.
Everyone worries about length of life at the expense of the thing that they can actually measure, which is quality of life. So they risk their quality of life for something that they'll have no control over whatsoever. So suddenly I started realizing that actually, hey, what's bad in sleeping better? That improves our quality of life. And lo and behold, actually, that tends to make people live longer as well, generally. But it improves their quality of life. What's wrong with exercise? That improves your quality of life. There is no doubt that if you start exercising, your quality of life gets better than if you are sedentary. And probably is good for your long-term lifespan as well. Same with stress management. And same with nutrition. Again, eating good, healthy food is good. It makes us feel good, but it probably is good for us in the long run. So the more I came round to the more I thought about it, the more I came round to the idea that actually the only thing we can manage is our lifestyle. And if we lead a good lifestyle, actually our quality of life gets better. And probably we have some impact on our length of life. So that's where after all this, after doing all this medical work and after doing all these degrees and after prescribing lots and lots of medications, I said, first it has to start with empathy, engagement with the patient, educating the patient about what's important in life, talking to them about these aspects of their life that they may be neglecting and they may be masking with tablets, and finally empowering them and saying, okay, do what is right for you. I'm here to support you. And that would work better. And that's where I then started saying, okay, well, maybe that's an idea worth spreading. Maybe it's an idea worth spreading towards people that actually just because someone says it's good, we don't know what. You're allowed to ask questions. You're allowed to decide for yourself whether the numbers work for you or not. Because at the end of the day, if there's a number there, then the number is the number. It doesn't matter whether you know uh, uh, a presidential physician looks at them or an ordinary person. The number is the number, and everyone has the right to be shown the number to decide whether that number works for them. The problem is all the medical journals and everywhere else, the numbers get hidden away, and they would say, "Oh, you take this and you double your chances of living longer." Well, that's a bit like saying you buy a lottery ticket. If you buy two, you double your chances of winning. The real chances of winning are still really, really, really low.
Right.
So why not give people the exact figures so that people can decide? And if there was a little bit more transparency, then there'd be a ton less distrust and anxiety in the community.